Hello, ladies and gentlemen. Today I'll speak about one of the most important subjects. I'll speak about burns and their relations to fasting holy moon of Ramadan. As for burns, there are several types of burns, but all can share that they can cause sudden shock to the patient and can affect life of the patient in one of three ways. First, the burns can cause neurogenic shock, which can affect life of patient. Secondly, burns can cause electrolyte imbalance, which also can affect the life of the patient. Thirdly, burns can cause loss of massive amount of fluids, which can affect the life of the patient. Now, let's speak about types of burns. First type of burn, what is caused by flames or boiled liquids, such as vapor water and boiled oils. This type of burns can affect the body in 3 degrees. In the first degree, which is the simplest degree, just redness and hotness and edema at the site of contact with this type of burn, and there is no piles, no abscesses, and there is severe pain, but no loss of fluids or even electrolyte imbalance. And this type of burn can be controlled. And once we control burn, patient can pass smoothly. In the second type of burn, we can find that the burn comes deeper. It passes through the epidermis and comes down to the dermis and even to the subcutaneous tissue. Causes more than edema and redness. It can cause destruction of the tissues to the subcutaneous tissue. And accordingly, patient suffers from 3 major problems. Suffers from main pain, and then suffers from electrolyte imbalance and loss of fluids. And accordingly, this type of burns in the second degree, patient is in need for controlling of pain by painkillers, and also in need for massive amount of fluids, which can postpone the lost amount of fluids. Third type or third degree of burn, in this type caused by flames and caused by boiled water and boiled oils, we can find the burn comes deeper. It passes from the epidermis and to the dermis and then passes to the subcutaneous tissue, even to muscles, and they can get rid of bones. And this massive and horrible type of burn can affect life of patient, can affect it by causing neurogenic shock or electrolyte imbalance, or even can cause loss of massive amount of fluids. In this type of burn, we can say that the patient can fast in the first degree only, once we control pain. But in the second and third degrees of burns, patient cannot fast Ramadan. Why? Because there is massive loss of fluids, and accordingly, he must postpone this amount of fluids by fluids either taken orally by mouth or can taken intravenously. Can taken orally in the form of different types of salts, and can be taken intravenously by fluids inside his body through either Ringer lactate or even through saline. This is the first type of burn, which is burns caused by flames and boiled liquids. The second type of burns, which is caused by fumes. And fumes, of course, contains carbon monoxide, and these fumes can affect children mainly and cause what is called laryngeal edema or even inability to breathe. And the child can breathe carbon monoxide and cause inside his body what is known as carboxyhemoglobin, which can affect the life of the child. The third type of burns, what is caused by chemical burns. And this subject is very important, dear colleagues. Chemical burns can be shown in different types. Either the patient can be affected by alkaline material, such as caustic soda, and this caustic soda or sodium hydroxide, once comes in contact with the skin, cause very severe pain first, and then massive loss of skin or even subcutaneous tissue and so on. In this patient, at first, you must go as quickly as possible by this patient and put running water. You must put running water to get rid of huge amount of caustic soda, and then try to neutralize this alkaline pain. How? Just by giving an acidic material present in our houses. Simply, you can bring vinegar. Equal volumes of vinegar and water can be put together and then push them on the site of contact of the alkaline pair. This will get rid of huge amount of disfigurement and can be controlled by plastic surgery later on. The second type of chemical pair is burns caused by acids, such as caustic water. This hydrogen peroxide can cause acidic burns, and this acidic burn also can be controlled either by putting running water or try to neutralize it by an alkaline material, such as sodium bicarbonate, which is present in our houses. Just 2 big spoons can be put on 1 liter of water and then all together to be pushed at the site of contact of this acidic pair. Third type of chemical pair is burns caused by phenol. And once phenol becomes in contact with the skin, you must also, as we said, put running water at first, and then you can put or neutralize it by using alcohol. This simply is third type of burns, which are called the chemical pair. And in this chemical pair, if the patient in pair is superficial, the patient can fasting after controlling of pain. But if the pair is deeper and comes deep and deep, this patient needs a huge amount of materials, of drugs, and also is in need of huge amounts of fluids in order to compensate electrolyte of balance of fluids present inside the body. And accordingly, these patients from the second and third degrees who had deeper pains are not affected to be fasting, but the first degree can fast. Now, dear colleagues, we speak about the fourth type of pains. This fourth type of burns, which are caused or called electric burns. These electric burns, as its name indicates, are caused by electric current. But we have to keep in mind that electric current has a point in which it enters, which is called inlet point. And there is another point in which electric current comes outside the body, which is called exit point. We have to keep in mind, if the line between the inlet point and the outlet point passes through the medulla in the brain, we can face 2 major problems which can affect the life of the patient. The first major problem is if this line, if this passage of the electric current passes through the respiratory center present in the medulla oblongata, the patient loses his breath. He cannot breathe. There is respiratory failure. So in this patient, anyone must need to know how to perform artificial respiration. This is the first major problem. The second major problem to face is that if the electric current passing from the inlet to the outlet passes through the cardiac centers, it can cause cardiac stop, and the patient died. And accordingly, any patient has to know how to perform external massage of the heart or even internal massage of the heart. So the electric pain is one of the major problems we face. And accordingly, in order to save this patient, first of all, you must separate the electric current. Otherwise, there is another victim besides the first victim. Secondly, you have to know whether there is respiratory failure to perform artificial respiration, or whether there is cardiac standstill, you can perform external or internal massage of the heart. Otherwise, your patient can pass smooth. And once the patient passes smooth and you control pain, you can let him fast. But if there is respiratory failure or cardiac standstill, the patient is in need for intensive care, and accordingly, you will not let him fast. He will take massive amount of fluids and painkillers and so on. Lastly, the fifth type of burns is what is caused by explosions or bombs or nuclear burns. And this type of burns is very horrible. Either it is simple, as those caused by radiations in clinics of radiations, or may be very huge and very massive and very horrible, as those caused by explosions of different types of bombs and nuclear burns and so on. Anyhow, for all these types, the first type can be controlled as we control the first type of burn, which is caused by flames. But the second type, we can find nothing in the patient except there is what is known bone marrow depression, and there is anemia of this patient, and this patient can be controlled by giving blood transfusion. Now, if we can summarize this, we can say, in this holy moon of Ramadan, the patient of burns is under our control. According to the type of the burn, according to the depth and degree of the burn, according to the age and sex of the patient, according to the distribution of the burn, we can say whether this patient can fast Holy Ramadan or not. But I can summarize simply that all types of first degree of burn, the patient can fast Ramadan, and after fasting he can take massive amounts of fluids, massive amount of water, massive amount of drinks with salts and so on. But if the patient in the second or third degree of burns, he is not allowed to fast Ramadan because he is in need for continuous massive fluids first, and he is in need for painkillers secondary, and he is in need to be in intensive care under medical control. Thank you.